But the most important reason of why it's worth it is because it makes our outcomes for our caregivers and our patients better. Because of that multidisciplinary approach, because of the access you have, because of the knowledge, skills, and dispositions that you learn, you're going to be more uniquely positioned to resource your caregivers and provide better outcomes than if you didn't go through a program like that.
We're going to start off really simple. Can you just introduce yourself and your role at SNHU?
Hi, I'm Dr. Dustin McLemore. I've been with SNHU since 2018, teaching in the healthcare administration, public health, nursing, and related health science programs. So as a capstone faculty, I get a chance to engage with students at the end of their academic journey, getting a chance to work with them, relaying all of the knowledge, skills, dispositions, and abilities that they've gained in their program to put it together in a final culminating deliverable. So I started classically trained as a research methodologist. I have been working in healthcare for almost 20 years now. Started as a bedside caregiver myself, and then progressed through different types of positions focusing on research, project, and program management to come to where I am now.
Tell us about the healthcare administration programs at Southern New Hampshire University and what is covered within the bachelor's and master's programs.
Absolutely. So there are several different programs. At the bachelor's level, you have two major focuses. One would be the BS in business administration with a focus in healthcare management. We also, though, offer a BS actually in healthcare administration. And in that case, you get to focus on two potential concentrations. One would be health information management, which looks at how we manage and utilize not only patient data, but medical records and things that come out of that in general. And then the other area is in patient safety and quality. And I see a lot of students gravitating to that particular concentration because they may not necessarily be a clinician, but they want to be able to speak the language when it comes to promoting positive outcomes, working with our nursing partners, physician stakeholders, and a variety of things. So the patient safety and quality realm is a great way to do that. And at the master's level, there are a couple of paths you can take. We offer the MBA with a focus in healthcare administration, management related components. But then we also offer an MS in healthcare administration, in addition to other related programs like the Master's in Health Information Management and our MPH. So when coming back to that Master's of Science in Healthcare Administration, there aren't any necessarily separate concentrations for the graduate level, but where the curriculum differs is in what you get. When you're looking at courses in the Masters of Science in Healthcare Administration, you're going to get a lot of those things that you look at in the patient safety and quality realm. So, for example, you'll focus on regulatory landscapes, policy development, specific courses actually in patient safety and what quality improvement means, because there is a difference between quality improvement and performance improvement and all those kinds of things. So that program really helps you break that down. But then you also get a little bit of a clinical focus without necessarily being a clinician, looking at things like biostatistics and epidemiology. And these are really important for administrators that may not have a strong or developed clinical background, but still need to be able to look at those key performance indicators that drive healthcare administration in general and understand, most importantly, how to tell the story, especially from an impact for patients and on population health. So looking at all of those things, it's really cool that SNHU offers so many different paths, whereas many other universities have a curriculum that's carved out, and the focus is very narrow, and they typically have one or the other. But in SNHU, depending on what your drive and your passion is, can determine where you can fit in that kind of tapestry of programs we have.
Such a great answer, and it's great to hear about, like you said, all the paths you can take at SNHU. That's what makes it unique. And this is kind of a basic question, but obviously an important one. What is healthcare administration and what does it involve?
Well, so healthcare administration is not just simply a program someone takes to be a leader in a healthcare role. A lot of times people think that that's what the primary driver of healthcare administration is. And realistically, when we look at the realms and the landscape of what is needed to be a good leader and administrator in healthcare, you're really focusing on driving change and improving outcomes at a systems level. It's a little bit different than clinicians, right? Clinicians, nursing, physician, NPs, PAs, focus on working directly with the patient to develop not only plans of care, but referrals and ongoing continuity. But in the healthcare administration space, you're looking at things like resource adequacy, everything from supply chain to funding and a variety of different things. So a healthcare administrator needs to understand that delivering care is not just a clinical focus. You've got to be able to speak the language when it comes to making policy and financing decisions. You have to look at how payer claims and reimbursements work. You need to be able to look at what role healthcare administration plays in influencing national policy, like with things for Medicare and Medicaid, variety of different things like that. But you also need to be able to support your caregivers. And so having that understanding in human resources, communication, leadership, and really being able to grow and develop your caregivers organically is something that healthcare administration is uniquely equipping graduates for.
So how does healthcare administration differ from healthcare management?
Well, a lot of it is the focus, right? We know that there are differences between leaders and managers or administrators and managers. And so when I think about the concept of healthcare management, I'm looking at the day-to-day operations of, leading a facility, leading a team, developing strong documentation, developing policies and procedures, and all of those organic components. And so I think that from my perspective, administration is sort of the larger capstone that management fits into. And so that's where I think some of the major differences is within management, you're focusing on some of those key tasks, like you would learn in, let's say, an MBA program where you're looking at budgeting and operations and all of those elements. But when you look at the healthcare administration piece, you have to focus on the strategic direction that all of those different elements take. And you have to understand that your focus in management, right, is not just task driven, but it is also outcomes focused. But at an administrative perspective, you're looking at not only how one facility or one region or whatever the case may be, or even one organization will perform. You're looking at the holistic continuum of care, right? From where the patient enters our continuum of care to when the patient exits. And so you have to be able to look at a broader toolkit, if you will. And so this is where understanding the role of advocacy and health policy and communication and nonprofit partnerships and a variety of different things like that at a system and continuum of care level, that's where the two, I think, differ a bit.
So the next question you've kind of answered throughout this interview, but what are the primary responsibilities of a healthcare administrator?
Well, I think you have to look at the role that administrator plays in the organization that they're assigned to. The great thing about healthcare administration is the field of what you can do is wide open. You can enter the workforce at a variety of different components. Let's say you're working in patient admissions or billing or in healthcare information management, a variety of different areas like that. You can also come in to an entry-level role in being a data or quality analyst, or a project administrator, project manager, project coordinator, and things like that. So there's a variety of different entry points that you can come into. But as you grow and develop in your career, you start to get to be involved in some of those systems level things that we were talking about, healthcare policy and management, not only just necessarily being a policy analyst, but also being able to advocate for policy. You get a chance to participate in grant writing and development. Sometimes if you're working for an agency, you get to be able to be on the panel that reviews those and makes funding decisions. One place where we see a lot of our students focusing in outcomes research that we've done after students have graduated is they land a lot in the healthcare policy and financing and financial management components. And this is a huge area that a lot of students really want to focus on. It goes far beyond just Medicare, Medicaid, those government contracting payer programs and private payer programs. This also looks at what it means to deliver care in a cost-effective way. So we're looking at how much care is costing at an individual patient level, but we're also looking at it by diagnosis, or what we call DRGs, or those are the types of groupings for clinical focuses. And we're seeing continually our resource adequacy to determine if funding is appropriately being spent to the best of our ability as healthcare administrators. And I think that's one place where students really find a lot of focus. But a couple of other areas that I don't want to leave out. One would be in our supply chain and operational areas. We see students taking administrative roles in supporting respiratory therapy units or developing the management functions to integrate into clinical supply chain delivery, right? Not only just within a facility, but let's say you work for larger organizations like medical suppliers, contractors, surgical instrument and technology companies, a variety of different things like that. But also, I think one area that we can't forget is our HR and caregiver engagement development areas. And that is an instance where our healthcare administration graduates can directly improve the self-efficacy of our caregivers. And that's that idea of, I believe I can. When we think about it from a collective efficacy or a team perspective, it's that we believe we can, right? So healthcare administrators really can help our caregivers be the best caregivers that they can be. And not only from an efficacy perspective, but also from a value perspective. And that, no matter what role you're in as a healthcare administrator, your ultimate responsibility is to deliver the best value that you can in care, not only for the organization that you work for, but also the caregivers and the patients that we support. And so looking at those variety of different areas, from supply chain to data analysis and quality management, admissions and billing, financial management, HR, that's just sort of scratching the surface, I think, of what healthcare administration graduates can do, and some different places that I think that they can fit in.
How do healthcare administrators impact patient care without being directly involved?
A lot of times I'll hear students say, well, I'm not a nurse, or I'm not a surgical tech, or I'm not an ultrasound tech, so I don't really know what I can do. I still know that I want to work in healthcare, but where do I fit in as a healthcare administrator? And the thing that I share with them, and this is especially cool in the capstone course, is you really get to see that as an administrator, you are deeply integrated in the care that is provided. So when we look at things like resource allocation, so for example, if you're thinking about in an acute care setting, healthcare administrators will work very closely with clinicians to develop surgical schedules, ensure that we have the appropriate ORs and resources and things like that, work very closely with clinicians on the hiring process to make sure we're bringing in the best people. We're really also about removing barriers. And what that basically means is taking that background that you leverage and develop in a healthcare administration program and things like budgeting and financial management and policy, you get to work with clinical partners to come up with solutions to make that care make sure that care is safe, effective, efficient, and satisfying. And those barriers are things that administrators are uniquely positioned to remove so that we can let our clinical partners focus on that core delivery of care function. That's really what we're trying to do. Throughout that process, you're also promoting resiliency. And what I mean by that is they take the role of quality improvement. We believe that quality improvement is a continuous journey, right? You don't just necessarily get to a particular outcome and then just stay there. You're continually redefining. And I think about this in a role that I had as a director of quality improvement and corporate compliance in an organization that I worked with. This was an organization that was a community health center, a nonprofit. So we were learning how to do more with less, so to speak. But one of the things I walked away from the years that I spent with that organization was that the people who were leading the organization worked so closely with our clinical partners that there was almost a blend between the two to really not see a differentiation, so to speak. But when we looked at continuous quality improvement, we get those quality indicators, the focus on where we want to do QI work or performance improvement work. All of that voicing comes from our clinicians. And we as administrators are then responsible for operationalizing that and really bringing it to life. So we're here to be partners. We're here to be working through barrier removal and all kinds of different elements like that.
So what types of organizations employ healthcare administrators?
If you think about the delivery and the continuum of care, there is really no limit to where a healthcare administrator can be. Obviously, there are things like acute care facilities, hospitals, those kinds of things, ambulatory clinics. Think about your local primary care provider's office, your oncologist's office, whatever the case may be. We see a lot of students going into, especially in entry-level work, working and nested in those areas. But then you think about this from how healthcare is positioned, right? It's not just an individual organization. It's really systems level. So myself, I spent many years working at an acute care facility that was part of a larger health system. And so as I grew, I got to work and take responsibility for multiple facilities, multiple hospitals. And you also get to work in national organizations, which is the work I think that's really cool. You get to have a big expanded footprint. So an organization that I'm closely associated with has ministries or hospitals in 7 different states. You also can work in clinical research organizations, whether it's a clinical research hospital or for manufacturers and pharmaceuticals doing clinical trials and those kinds of things. But then you also can have a focus on the nonprofit perspective too, if that's something that really drives you, right? If you're really connected to specific patient populations or mission-driven type of approaches, the nonprofit space is an excellent way to be able to integrate that. And that doesn't have to be just at a local level. There are multiple organizations that run nonprofit healthcare at a national and even global level. And then probably one of the other areas that maybe sometimes gets overlooked is in the education realm. You can become a faculty member like I am, or you can work as a nurse planner if you have an RN or clinical background. So we also see it finally in the government and agency realm, looking at roles like in the CDC or in NIH, which is the National Institute of Health, CMS. You can do this at the state level. For example, if you're in the state of Colorado, you could be a part of the Colorado Department of Healthcare Policy and Financing. You can do it at a local level, which is actually where I got my start as a public health outreach specialist for a county and city health and human services department. So the door is really wide open from care delivery at an organizational level to systems, to nonprofits, to research, to government and advocacy, enabling and supportive services. There's really no different places that healthcare doesn't touch, if you think about it.
So obviously healthcare is one of those fields that is constantly changing and evolving. How has technology changed the field of healthcare administration?
Well, I think when people look at the concept of technology, the first thing they think of is our transition away from paper charts to medical records and electronic space, right? That was the big focus in HIPAA, which was enacted in 1996, but really wasn't fully implemented until beginning in 2002. So that's when we kind of started seeing that transition. There was other legislation in around 2010 and 2011 that really advocated for the use of electronic health records. But where we've seen really significant growth in the field of technology and healthcare is in I would say the last 10 years is probably one of the biggest areas. The first was the emergence of data, developing our data assets, really getting visibility in how we deliver care. We were able to take clinical data, we were able to take financial data and marry the two to properly steer our resources in the right directions. And so we're really seeing the advent of decision support, business intelligence platforms. Lots of organizations are running very lean off of data assets and things that include platforms such as Microsoft Power BI. They're rolling in, Microsoft Power Platforms, developing applications that are specifically used within context. And then we're also seeing advances in technology that make care delivery better and easier. Looking at things like advances in imaging systems, I think is one place where we see that. And this is more from a clinical perspective, but physicians, nurse practitioners, physician assistants, they're able to see things, trends, and utilize imaging tools and things like that to improve outcomes overall. And healthcare administrators play a unique role in that, right? They're there to work with those clinical subject matter experts, find the resources that they need, and make sure that they're connected. But I think one of the biggest areas where we've seen some change, and this is something that's quickly emerging, is the use of AI in healthcare. We've started to see this in areas such as clinical documentation and research. There are programs like MedPearl and others that provide clinicians with the most up-to-date information on how to make healthcare decisions when it comes to courses of treatment and those kinds of things. But we also see AI in the healthcare administration space. For example, ERP systems, which are enterprise resource planning systems. Those are the programs that you'll use to manage your supply chain, HR functions, human capital management, those kinds of things. We're starting to see AI being able to assist caregivers with writing performance goals or looking at a variety of different things they've done and helping them come up with 2 or 3 major bullet points to encapsulate their work over the last 12 months. We're seeing it help people develop goals for the upcoming year. But really nothing can ever replace that human component. But AI, I think, can be a great partner in that. And so we'll see that in a variety of different areas too. One project that I know that I'm working on right now is the role of artificial intelligence in supply chain delivery. So what basically that means is we have so many administrators that spend a few hours a week looking at their supply rooms, determining how many of this particular thing they might need, writing it all down, and then spending a whole bunch of other time entering it into their ERP or ordering system and all kinds of things like that. Well, a new technology that's being developed right now actually allows caregivers to take a picture of an item before they take it to a room or when they're restocking a room. And that item will, once it reaches a threshold, the system will automatically reorder that. So there's no need to have to do an inventory reconciliation, manually enter all that information. And the great thing about that technology is it's customizable. Let's say you want to be able to look at that requisition before it goes out. You have the ability to do that. Or if you want end-to-end automation, you can do that. So the role of AI and machine learning, that's what drives that ability. And so I believe that technology is never meant to replace the work that our healthcare our clinicians and our administrators will do, but it can be a very powerful ally.
So I'm going to switch over to public health. And what role does healthcare administration play in public health?
This one is a question that I think is very meaningful for me because I got my start in public health. And at the time, I think my focus was so narrowed because of the work I was doing. It wasn't really until I had evolved throughout my career that I really saw the role that healthcare administration and public health can create together. Number one, healthcare administrators can be partners to public health clinicians and local administrators, state administrators, federal administrators, those who are in charge of running those agencies and making funding decisions. Local healthcare administrators can link our clinicians with those policymakers to provide expertise and perspectives on the way funding should be used and how policy should be developed. From a public health perspective, though, this is one of the reasons that our healthcare administrators take courses in patient safety, quality, and epidemiology, because epidemiology is primarily a public health field, but administrators need to be able to understand the impacts on disease source and spread analysis, what kind of decisions we need to make to be able to proactively cap the spread of disease and infections. We saw this in COVID being one major area where you saw administrators and public health officials working very, very closely. But another area is in something that I talked about a little bit already, and that's around supply chain resiliency. We had a hurricane in 2024 that hit a major IV fluids plant and sterile water plant. And that one plant produced almost 2/3 of the nation's IV and sterile water supply. So in that case, healthcare administrators had to work with local health practitioners to come up with alternatives for care delivery, making decisions on how to conserve those fluids and still provide the care that was needed. And so that was very much of a partnership between local public health experts and administrators to develop those pieces. But I think another places where a healthcare administrator can really support public health is in the area of data analysis and decision making, because public health trending really requires on deep data to be able to understand from a program planning perspective what it is we're going to do. Where are we going to focus? Are we going to focus on the communicable diseases such as HIV and tuberculosis? Where are we going to focus on emerging issues such as the opiate crisis or a variety of different things like that? Healthcare administrators can help public health agencies develop those data assets and make more informed decisions. And I think the last area where public health is impacted by healthcare administration is in emergency response and planning. So we see a lot of emergency response functions being taken on by local and state governments, even at the federal level. But what they're doing is they're leveraging local healthcare organizations to be able to empower the people that are actually carrying out those emergency response functions. And so when we look at policy, partnership, nonprofit support, data, there's all kinds of different ways that public health and public administration or healthcare administration, the three of those really come together.
So switching back over to the degree program, what's the difference between a Master of Healthcare Administration and an MBA with a healthcare focus?
So there are two healthcare administration programs that we have in addition to the other master's degrees that we have. Number one is the MBA, right, within healthcare administration, and the other is the MS. The way those programs differ is in some of the specialized training that you get. I will say that there's a lot of overlap in some of the management, accounting, communication, those basic business courses. But where, let's say, the MS in healthcare administration differs is going to be looking at courses that are specialized in public safety or public health, patient safety, and quality and epidemiology. So those clinical disciplines that we talked about, like getting those administrators the ability to speak that language, that's where the Master's in Healthcare Administration really does come in. When you look at the MBA, you're going to develop specialized focuses on strategic planning and a deeper focus on the role of data, connecting a little bit of the policy realm to the larger focuses in things like accounting and financing and policy. So when we talked really about the different things that healthcare administrators and students can do, most people choose a graduate path based on a passion that they have or what they want to accomplish next in their professional context. And so if you want to continue to be a clinical resource or a clinical partner, the MS in healthcare administration is a great way to do that, especially if you're going to focus on public health or nonprofit work, things like that. But if you want to develop a strategic vision and look at those business related components such as accounting and finance, the MBA offers a great path to be able to develop expertise in those areas. And there are crossovers between the two. And I think a person that goes to either program would be equally equipped to come up with and develop career plans that will change healthcare for the better. But there are some specialized things that you walk away with from each. And both programs are massively gaining popularity right now because healthcare is the single largest employing industry in the country. And so there has never been a higher demand for people going either path than there is now.
I'm just curious because it's an online program. Is there an advantage to having students from all different states being in a program together, talking about where they're from and how policy is different in certain states?
Yeah, absolutely. We see that at both the undergraduate and graduate levels. Very often, you'll see one of the biggest areas where we see some advantage of that is in our discussion forums, because our discussion forums prompt students around specific things that they may be working on. Let's say looking at what stakeholders their particular project or initiative or organization works with very closely. But then it's also really helpful in areas like compliance and regulatory affairs, because even though we have a national framework, so to speak, of policies and regulations, it really does vary from state to state. If you think about it, right? California may have a completely different regulatory landscape than Texas or Florida. The same being with policy priorities. If you look at states that have lower population density, states like Wyoming versus higher population density states like New York, they're going to encounter some of the same challenges, but then their challenges are going to be somewhat unique. For example, we have a lot of students that live in states where rural care is most of the state is in a rural location, and care in rural areas has its own challenges. Things like provider availability, technology, patient access to care, those kinds of things. And so I've seen students from states where that or locations where that is more common provide some really valuable insights to students that are in states with higher population density, but still parts of that state may struggle with access to care because they're in a rural area. Large states like Texas and California are perfect examples of that. They have large population centers, but they also have states that are parts of the state that are very sparsely populated, but that still need healthcare. And the last thing I'll kind of talk about in this area is we see students really collaborating on potential solutions based on that local expertise that they have. And so in the capstone course, for example, I have students that are developing a problem of practice in a target population, but maybe the local geographic area in which they live doesn't necessarily have that challenge, but maybe that's a passion for them. You know, it's very common for students that live in urban areas to be passionate about rural health, and especially in provider availability, nursing shortages, physician, PA, NP shortages, those kinds of things. And so I've seen students that live in that context on a daily basis be able to provide some really valuable feedback and unlock new ways of solving problems. And I've also seen it the other way, right? Students that are in contexts that have high access to technology, the latest technology advances, those kinds of things. They can provide that expertise and really help each other remove barriers. And even though it may be a conceptual work that we're doing in healthcare administration programs and undergraduate work, undergraduate and graduate level, many of my students take that with them to their professional context. So it goes from being a conceptual thing that you're working on in a healthcare administration program to actually operationalizing that solution in a real healthcare organization. And so that expertise that they got from that interdisciplinary study that you were talking about really helps them bring those solutions to the next level.
Yeah, that's very cool. And speaking of the professional level, how do healthcare administrators influence healthcare policy at local, state, or national levels?
Well, so the variety of different ways that healthcare administrators can actually be a voice for their patients and for their caregivers is probably one of the most common or widely known ways. Working in policy advocacy, I think, is one big place where healthcare administrators can take their expertise and help policy makers and regulators make the most appropriate decisions for how we shape policy, what standards we have to meet, and those kinds of things. Because those administrators can not only do that from a policy perspective, but also from a funding perspective. A lot of policy has funding attached or tied to it. Major grants by the CDC and NIH, for example, or National Science Foundation, all of those are policy driven, right? And so healthcare administrators being able to provide expertise and the real world context for the business case for that, I think is something that's very important. They can actually help those people that are developing policy, making funding decisions, see the actual current state of what is broken and what's working. And they can also then attest to the efficacy of that the funding or policy changes will have in making care delivery better for our patients and our caregivers. But another area that I think is important is the local and state partnership part of this. We talked a little bit ago about how healthcare administrators can find a real home for their work in nonprofits and community and local and municipal, county, state agencies and those kinds of things. Even if healthcare administrators are in a private context, a hospital, a local clinic, whatever the case may be, their patients still need access to resources. And when I talk about things like that, I'm looking at enabling and supportive services, public health outreach, housing, removing those barriers to access to care. Those policy really should be about removing barriers and making health outcomes better. And healthcare administrators are really uniquely positioned to be able to do that from a community health partnership perspective, from a funding perspective, and also from an efficacy perspective for policy.
So my last question is, why is earning a degree in healthcare administration worth it at both the bachelor's and master's level?
Well, I think there are a couple of different reasons why the degree is worth it. I should say at the outset, though, it really all depends on what you want to accomplish. And if you don't know, that's actually okay, because a bachelor's in healthcare administration, or whether it's in nursing or whatever the case may be, right? Especially from a healthcare administration perspective, it really gives you so much exposure to the variety of different disciplines and domains that we as administrators operate in, that it can help you actually find your passion and unlock your drive for accomplishing something. It also gives you problem-solving skills that I think are unique to not going through a program like that. So you're looking at the role of strategic planning or research methodology and data analysis. There are certificate programs that can give you that, but the holistic focus in an undergraduate or graduate program makes you as a student or as a applicant or as a practitioner, right, uniquely positioned to be able to do that. The other thing that I think also we have to think about is, and before I move on to the master's level, is that many roles and responsibilities now, positions and things like that, call for a minimum of a bachelor's degree in the work that they do. And the reason for that is that employers see the value of those those knowledge, skills, and dispositions that I talked about in the various programs that, like at SNHU we talked about the different master's and bachelor's programs that we have here at SNHU. That curriculum is continually reevaluated for resonance, applicability, and a broad overall application. And so by going through a program, you can also ensure that you're not learning things that are outdated. The curriculum, the work that you're going to be getting from your faculty is not a decade behind or anything like that. By having access to faculty, and this is one of the things I love about being a faculty member, by students having access to faculty, they also have access to subject matter experts in various areas, right? Because as faculty, we teach courses not just on a random basis, but courses that align with our subject matter expertise. And so if a student has a problem or a difficult challenge that they're working through in a professional context, faculty are great resources to be able to help them break those down. And at the master's level, I think this is where the specialization and things like that continue. Many people enter a master's program to evolve their professional context, especially if you're going into mid-level or senior level leadership positions. A master's degree in healthcare administration can make you uniquely positioned to be able to speak to some of those systems level outcomes that we were talking about, understanding the role of policy, but also understanding the importance of caregiver engagement and communication. But the most important reason of why it's worth it is because it makes our outcomes for our caregivers and our patients better. It really does. Because of that multidisciplinary approach, because of the access you have, because of the knowledge, skills, and dispositions that you learn, you're going to be more uniquely positioned to resource your caregivers and provide better outcomes than if you didn't go through a program like that.